Good morning, ma'am.
Morning. Then, how was your night? I hope you slept well.
Very well, ma'am. Very well. Thank you.
All right.
Very well.
Okay.
Thank you.
So, Madam Patience, good morning.
Good
It's
morning,
nice to have
madam.
you here today. Trust you slept well. Did you rest enough?
Yes, I did. Thank you so
Okay.
much.
We thank God. Thank God for life. Okay, so we'll just quickly, because we don't intend to waste time, we want to continue from where we stopped yesterday. Yesterday, we looked at introduction to pharmacy practice, what it entails to be a pharmacy technician, and professional ethics, that's ethics and professionalism in that field. And we looked at pharmacology, pharmacokinetics, and dynamics too, pharmacodynamics too. Yesterday, we looked at those aspects briefly, and today we want to look at pharmacy calculations. So we are going to be working together. So it's important you bring back, remember the mathematics story I told you yesterday. So you you bring that back, and perhaps you have a pen and a paper close to you so we can do a little bit we can do some calculations. So practically, calculation is very, very important for pharmacy technicians because you deal with doses, you deal with figures and numbers and times a patient has to take a particular medication. So it's important that you actually have an idea of calculations and how to calculate. Very important. Okay, so we are going to be looking at how we can calculate these things based on the different subheadings we are going to have, how we can do addition, do subtraction, do multiplication, and division as well as we progress. So let me just take it to, let me just put it in slide mode so that it will be easier for us and we'll be able to see everything better. Good, I think. This is perfect. I have shared my screen and I guess we can all see. Can we see?
Yes.
Is it clear there?
Yes, it
Okay.
is.
So we want to look at basic. Thank you. Want to look at basic. Oh, why did it get bigger? Okay. So want to look at basic arithmetic and units of measurement, basic units and basic arithmetics. That's addition and subtraction that we are going to be doing when we are actually on the field of this doing our jobs as pharmacy technicians. Okay, so it's like I already said, the need cannot be overemphasized. It's important because you have to calculate doses, you have to prepare medications, you have to count, do a lot of counting, maybe drugs that are remaining, how many do we need, how many have we received, you do a lot of math. You have to have that foundational math skills that you learned in school because it will come in handy in the course of you actually carrying out your duty. So we have the addition. So let's look at it. Since we have different doses of drugs, it is important that we calculate and know what is the right dose, how many will it be, how many tablets, and so on and so forth. Okay, for example, just imagine that you are preparing a medication. Let me just give you an overview of what we are going to be doing. Imagine that you are preparing a medication, maybe a drug or medication that requires that you combine two different liquid solutions. For example, want to look at the addition aspect of it. You have to combine this particular milliliters of this drug. You add it with another quantity of another kind of drug. So take, for instance, that you are required to do that, two different liquid solutions. Now, you have maybe 200 milliliters of solution in container A, for instance, and then you have 150 milliliters of solution in container B. Now, what would be the total? You have to combine the two. So if you have 200 here, you have 150 here, you add it together, what is going to be the expected quantity of the combined solution that you will dispense? Who can help us with just
350
that?
milliliter.
That's particular
350.
mathematics. So that I need that
350 milliliter.
350. Thank you. Thank you. So that You are very good math students. Please just put your hands together for yourselves. You are wonderful mathematics students. Okay, because people struggle with mathematics, so to add and to subtract, it's not easy. Some people, not everyone anyway. Okay, so that is practically what we are going to be looking at. I just wanted us to have an idea. So when you are combining maybe quantities or looking at total doses over the period, you need to add, or you have to add maybe number of tablets dispensed over a course of treatments. Maybe someone that is supposed to take a particular medication for 7 days, like they used to do antibiotic, they can tell you one morning, one evening, take for 7 days. So you have to take in the morning, you have to take in the evening for 7 days, and then you compute it and then know how many you are going to be taking. So if you are taking for 7 days and you have to take 2 times in the morning and in the evening, and you are asked to give the total number of drugs that particular medication that should be given to that person to complete the 7 days dose, what will the answer be?
That is
Please come
14
again.
tablets. 14 tablets. Okay. What's wrong?
Come
Okay,
again.
14 tablets. 14 tablets. What I was saying, yes, that's what I'm doing. I said that, for instance, you may have to be a situation where you have to give a person antibiotics, and the person is actually taking the drugs for 7 days and is placed on 2 daily. That drug is supposed to be taken 2 daily, in the morning, 1, and in the evening, 1. Whoa.
So
1 in the
14.
morning and then 1 in the evening. You're supposed to be taking
So
it. So it's
14
going to give us
tablets.
14 tablets.
Tablets.
Correct. It's going to give us 14 tablets. Okay, so that is practically the addition aspect of it. Then we also have the subtraction part of it, subtracting. Now, it's used to adjust quantities, maybe partial doses given, or when you are subtracting stock from inventory. So you have to do a lot of subtraction. If there are 20, you've taken 7, how many do you think will remain? That is subtraction. So you see, we've talked about addition and then subtraction. Also, now subtracting tablets from stock when refilling prescriptions, we've already talked about that. Now, let me give you an instance of subtraction as we go. I want us to understand it as we progress. Now, you have a bottle of medication that contains 500 milligrams mg, 500 mg. After dispensing 150 mg to a patient from that 500, you have to subtract and find out how much is left in the bottle. You had 500 mg, and then you've dispensed 150 mg from the 500 mg. So you know that it is subtraction. What would you have left? What would be the figure that is left? Who is going to
350
help us? 350 mg. So it's simple. Okay, so we are just going to move these slides and move because it's something that we are already on the same page. So that is just it. Sometimes you have to add, sometimes you have to subtract, like we have just talked about. Then sometimes you have to multiply. Multiplication is a way maybe to add the same number multiple times over and over again. Those of us that are still very, very abreast with what we learned in mathematics in the primary school, multiplication is simply repeated addition. That's how we teach children, repeated addition. So if you have to add repeatedly in a number of times, it becomes multiplication of that particular thing. So a prescription requires, let's give an instance, a prescription requires a patient to take 250 milligrams of a medication twice daily for 7 days. That is to say 250, like we talked about. I think we did something like that. This is multiplication, repeated addition. So 250 milligrams of a medication twice daily for 7 days. Now, find out the total amount needed for the week. You can use multiplication. So who will multiply it for us? 250 mg to be taken twice a day. That is morning and evening. You take 250 in the morning, you take 250 in the evening. Now, you are taking that particular dose for 7 days, which is 1 week. So what would it be at the end of 1 week for you to be able to know how many tablets or what's the quantity of medication to give that person?
3,500 mg.
35
mg.
Wow, that's beautiful. 3,500 mg. We are very good mathematics students. So you see how you can multiply. You need to be able to do that, because if you don't know how to multiply, to add, to do all those things, you would mix up the drugs, the medication for the patient. You either not give a complete dose, the person will find out that, I've been taking it as you said, but it's not enough. It wasn't enough for me to complete my dose. There will be issues. So that is why to have the background knowledge of how to multiply, to add, and do all these things is very, very important and paramount for us to understand. So you would need to know that it is 3,500 mg of that medication that the person is supposed to take for the entire week. Okay, so that's multiplication. Now let's move to division. Now, division involves you splitting a number into equal parts, or finding out how many times one number fits into another. That's division. And it's normally used when you are dividing maybe doses into smaller increments. You want to just add, such as splitting the doses or converting between units. Now, I'll give you an example so that you understand what I've just said. You have a 1,000, let's say maybe a 1,000 milligrams tablet of a medication, 1,000. But the doctor prescribed only 250 milligrams per dose. Now, you as the pharmacist or the pharmacy technician, there with you in the pharmacy, you have the container is 1,000, like you have 1,000 mg tablets of that particular medication. Now, but the doctor prescribed only 250 mg out of that 1,000, and you need to figure out how many doses can be obtained from the tablet. How do you figure that out? Very simple. 1,000.
You divide the 1,000 by 250.
Yeah, that's four. That's
okay.
4.
So I've seen 4. Yes, 4. So I've seen clearly that we just need the certificates, I guess. So, Madam Patience, we just need the certificates. Madam Patience and Madam Nenna, both of you just need the certificates, as I can see, because you are already involved in the, like Madam Nenna that has not actually been doing the drugs thing, maybe not working, actually involved in the practice. She's already been doing it, so she already knows it. That's so beautiful. So, Madam Nenna, so but how are you calculating like that? Okay, that means you must have been a very good mathematics student in secondary school while you were in school to just add it out and bring it. So thank you. He said maybe. Okay. All right. So you see that at the end, you are having 4 doses from that 1,000 mg tablet. You divide. It's as simple as that. So you see where all this come in. So understanding these basic calculations is important for pharmacy technicians, as they ensure that accurate medication, preparing this medication, dispensing them, whether you have to combine the solutions, or you have to know the remaining quantities, or you have to calculate the total doses, or you have to split these medications. You have to have a solid grasp of all this math skills, the addition, subtraction, division, and multiplication. Very, very important to ensure patient safety and effective pharmacy practice without errors. That's why this is very important for us to learn. So this slide, like you can see, it's very simple. It's just an overview of the reasons why we should have this particular, why we should take this into cognizance, how to add and how we should subtract. Fine. So let's see what we have. Now, there are 3 main measurements that are used in pharmacy practice: the metric, the household, and the apothecary methods. So let's look at them as we progress now. This is the metric system, this is the most commonly used of all the 3 measurements of drugs and medications. Now, the metric system, like you can see there, is commonly used today, making use of technology. And in big pharmacies, we have the metric system, which includes, their units includes milligrams, liters, like we have the milliliters for liquids, the mgs for solid drugs, that we use mg for those drugs that are solid, and then the milliliters for the liquids. And also, not only knowing the calculations, it's very important for us to understand how to change from gram to milligrams, from liter to milliliters, you know, all those things we learned in school. There is a timetable that we learned. Some of us have it behind our books where they used to have 10 centimeter makes 1 decimeter, all those things, those type of measurements that we learn. So it's going to come handy when we are doing this. Like you can see 1 gram makes 1,000 milligrams, 1 liter makes 1,000 milliliter. Very important. That is the metric system of measurements in pharmacies. So sometimes you get to see your drugs in milligrams, in milliliters, that's mLs. Okay, then we also have the household system too. Household system that is used for a patient's instructions, you know, to give patients the instruction. This is what you would do. You take this teaspoon or you take this tablespoon. So it's important for us to know those ones, especially the liquid drugs, the liquid medications. You have to take 1 teaspoon. And so you should know that, like mothers that we are, sometimes they'll say 1 teaspoon. So originally you would know that, okay, 1 teaspoon equals 5 ml. So if you don't have a teaspoon, you can use that container. There's usually a measuring container that is always put there with most drugs, especially for pediatricians. You prescribe those drugs for children, you know, so they will have to give you that container. So you measure it. So in a situation whereby maybe the container after the first day, like it happens in my house, or the second day, the container goes into transit, you know, we don't see it, it moves. So we don't see it again. So in such situations, when you don't have that container handy, you can just decide to use 1 teaspoon, knowing that, okay, it's the same as 5 ml. I was asked to take 5 ml. And then the tablespoon too, 15 ml. 1 tablespoon equals 15 ml.
Really? It's 10 mil?
No, it's 15.
I used to think it's 10 mil. Okay.
It's 10 mil.
So it used to, no. It used to be 10 ml. It used to be 10 ml. But if you carry a teaspoon, even now, carry a teaspoon and put the drug, it depends on how you put. You know, some people put it up to dripping, but the normal measurement of a teaspoon, it is 3 of it that enters a tablespoon. So if 1 teaspoon is 5 ml, then 3 of the 5 ml will be equals to what? 15. Most of the pharmacies, most of the maybe where they sell drugs or where they sometimes they say 10 mils. Yes, I agree with you. Sometimes even in the hospital they'll say 10 mils. But if you look at it critically, if you want to look at it the way it is, the way it has been confirmed, if you take a teaspoon, you can try it when we finish this lesson class. You take a teaspoon, measure the drug, measure it. Don't put it to the brim that will be dripping. Just put it in the normal way you put something in a spoon. Turn it into a tablespoon, a normal size tablespoon. 1, 2, it will not fold it. It will not make the teaspoon filled. So automatically you end up having about 15 mils of that particular drug. And as we progress too, you will also see that we have other ways that we can also, even if you are told 10 mils, considering the age of the person, considering the body size of the person, you know that some of these things will alter. It's not cast on concrete.
Yes.
I don't know,
Yes.
Madam Pat, since you are actually,
Yes, you are right.
actively there.
Take for
Okay.
instance, you are right. Take for instance, there is a girl of 12 years old, and she have malaria and typhoid.
Good.
So in the normal sense, when you are treating with antibiotics, for that age, you are not supposed to give an adult dose. Take for instance, if you are using coamoxiclav, it's normally 625 or 1 gram. But that child is weighing, the girl is weighing 75.
More than correct. Good.
75. Because of that, in the normal sense, she's supposed to take half of that 625. But I give her 1 tablet in the morning, 1 tablet in the evening because of her body weight.
Correct. So you see, so these things, even though they are like this, they are not cast on concrete. There is how you can weigh the situation, maybe based on certain factors. You say, okay, this person has to take the 10 meals, so it has to be small, you know, or the person takes the 15 meals, the person is big. So it is advised generally that you use certain factors to actually streamline it based on how you see the person. Age too is another factor aside the kg. The
Yes.
age of the person also matters when we do these
Matter.
things. So we also have the ounce too, which is 30 mils. So we have, these are household systems of measuring measurement units of, thank you, of measurements. Okay, so we also have this another kind of method, though this one is not very, very common. Thank you. Take it away. It's not very common now because technology has actually taken over, but it's still used in some kind of prescriptions in some areas, you know, they still align with this older system. So we have units like the grains for solids, you know, we count it in grains. Then with GR, then we have the fluid, the ounces. You can see FLOZ is the what we use for the liquids. Then the conversion too, like you can see, 1 grain equals to about 60 to 65 milligrams, depending on the context. If you are going to maybe equate it to the milligrams, that's why it is there. So if you are not using the milligrams, but you are used to the milligram method and you find yourself in such a situation, simply for you to know that, okay, 1 grain, if I'm still going by grains, 1 grain will give me an equivalent of 60 to 65 milligrams. Very important, depending on the context that you find yourself. You know, we talked about different pharmacies, community pharmacies. It can be in the villages, can be in the local areas. So there are some that still abide by using these grains, using this particular ounces for fluids or for liquids. So I think we can move. All right, now we also we want to look at another mathematical angle too, converting between different units is a critical skill for pharmacy technicians. You know, like we already talked about earlier, you should be able to like know that a gram equals to 1,000 milligrams. So if it's something that you see a gram there and you want to convert it to milligrams, you should know that, okay, 1 gram is this. So if it is something like 5 grams, maybe if it's a medication that is 5 grams, you automatically know that, okay, it will be 5 grams times, and I want to change it to milligrams, it's going to be 5 grams times 1,000 milligrams, which will give me 5,000 milligrams for the 5 grams. So this conversion thing is very, very important for us to like learn it. I know as we progress, as time goes on, we keep learning on the job. So it's not so difficult at the end of the day. So, all right. So we also have other methods of conversion. We have the liter. 1 liter equals to 1,000 milliliters. 1 teaspoon equals to 5 milliliters. 1 tablespoon equals to 15 milliliters. 1 fluid fluid ounce equals to 30 milliliters. So these conversion methods, it's excuse me, it's very important. And did you get me water, please? Now, conversion methods, we have already seen it there. 1 grain equals to 60 milligrams, 60 to 65. That's how it's supposed to be, between 60 to 65 milligrams. Then we have the ounce too, that gives us 28.35 grams. Now, the beautiful thing is this, when we have trainings, especially when we have trainings with MJB management, what they are very good at doing is you get to have these slides. At the end of the training, you will have the slides. You can personally on your own sit down and do what you need to do before the professional exams. I guess we have been going through the platform and we are aware that we will take a professional exam, which I know will just be a walkthrough for us here. It's going to be a walkthrough for us. So are we aware that we would have professional exams, please? Please, can you hear me?
Yes, ma, I can hear you. Yes, I should be aware now. This is not my first time of taking your call, so I should be aware that you
okay. Yes, you know why I'm asking? Because this pharmacy technician group has been very, very quiet. Like, you know, we don't really have. So if it's the other ones, would have been having like Madam Nena knows, they would have been asking you this, asking you that. Oh, exams is going to this and that and that. But the pharmacy technician group is one group that I saw that was very, very quiet. I know because this is December anyway. They normally will have it.
more matured here.
You say you're more matured, Madam Nena. So the other side, maturity was not there. Well, it's true because
That's why we're quiet.
okay. No, I don't. It's well, yeah. Maybe there are people that are more matured, but it depends on the individuals because over the years that I've been doing trainings, I've seen it all. I've seen all the aspects of it. There's the group
Yeah.
they talked and talked, CNA, certified nursing assistant group, they talked that's anything talkable. They will talk
Okay.
there, they will, they want this. They ask you, oh, are you sure they will not run away? Where is your office? Where's different things? And sometimes
Even
sometimes you get to read.
somebody in this particular group, I don't know who, but the person was private asking me or something. I was asking
You
me
can see.
if he's a genuine. I said very genuine, 100%. So I don't know what happened.
You will not blame them. Thank you so much for giving us, even when you have not actually finished the training, but you had to vouch for us. That's beautiful. I really appreciate that. The fact is, the country is not good. And the people that actually scam people are the ones creating all those challenges for us. Because the more people get exposed to these scam activities for online trainings, it affects us. Because when people come in, the first mindset they come in is, I don't know, let me put only one leg. I have people that had to just pay a little. They paid the first installment and they were so scared before they even made the first installment. They were just afraid. But they had to wait. Do you know that after they started the training the second time, this same person I'm talking about just came and cleared all the payments and wanted to take another training that was on the line. So I had to, because I'm a very funny person, so I had to tell her, really, so you were just like a chicken. You know how a chicken would do. A chicken will first step with one leg first and be sure of the ground and be say, let me try you in case these people run away. So I know that at least I don't have too much loss. So we understand these things. It's perfectly understood. It's not easy for you to cough out money and at the end of the day, you start hearing stories. So we appreciate everybody that actually patronizes us as we have built our name over the years. And we are sure that God will help us continue. So let's move back to what we were doing. Sorry for that digression. All right. So we were actually talking about the different units of measurements, how to conversions in the different units of measurement. So we want to just have some examples. Here, like we can see, a patient is prescribed 500 milligrams of medications, though we've already done something like that, but well, let's just see how we can still do it. You would multiply to find the patient needs to take 2 tablets. Very simple, like we did already. If you have maybe a patient is take 500 milligrams of a particular medication, and you in the pharmacy, you have just 250 milligrams. So what you can do is you can multiply it to find the patient needs to take 2, because 250 times 2 will definitely give you 500, which will be equal to the actual prescription of the medication for the patient. It's as simple as that. A prescription calls for 2 teaspoons of a liquid medication. Since 1 teaspoon equals to 5 mils, you will convert this to 10 mils for accurate dispensing. 2 teaspoons, 1 teaspoon, 5 mils. So you convert it to, because they need exactly 2 of the teaspoons. Good. So that becomes 10 mils. So mastering this conversions is very, very important for pharmacy technicians so that we'll know what to do. Needless to talk too much on that. We've actually passed that side. So how do you do these dosage calculations? You need to do it with confidence. You need to build that confidence, because with confidence makes you perform better. That is where you have to actually have hands-on practice of these things, because when you do them, or someone that is already involved in the field, it's very easy for you to build that confidence already that you would need to interface with a patient that actually come around to the pharmacy to get drugs. It's easy for you to relate. That's okay. All right, so now let's look at the next factors that we have here, that the correct dosage can be based on different factors: converting between units, adjusting the dosages for different routes of administration. Like we talked yesterday, there are different ways that medicine can be taken. Orally, can be taken topically, through on the skin. Why is this thing jumping? can be taken like medications that you need to maybe apply, you need to rub. It can be intravenous. There are different ways. So calculating these dosages, like we already said before, can be based on weight, like Madam Pat gave an illustration. That time it can be based on the patient's weight, it can be based on the ages, the age of the person. So when the prescription is given, a specific figure, dosage will be there. So you as a pharmacist, you have to understand how you can see it, make sure it aligns with the patient's weight, the actual drug the person is supposed to take. If you have any concerns, report to the pharmacy. That is why the pharmacy is there. And then the pharmacy can network with the members of the group. That's why anybody that brings a prescription to you should have a name, should be filled properly. We'll get to that, so that you'll be able to reach out when the need arises. In case of anything that is not adding up, you'll be able to get it sorted. Okay, now let's look at dosage based on weight. We want to now look at the practical aspects of what we've been talking about. Now, especially in pediatric patients, we really look at the weight of a person. So the dose is dose per kilogram times patient's weight. That's how it is multiplied to actually get the right medication. So if a medication is prescribed at maybe 5 milligrams per kg, and the patient has come is weighing, the child is weighing maybe 20 kg, like it is here, all you simply need to do is to times the person's weight with the milligram of the drug that the person is supposed to take. At the end of the day, you get 100, just as we have here, 5 milligrams per kg times 20 kg. So if the person is having 20 kg, it's just for you to times it. And when you do the multiplication, you would have 100, you have 100 milligrams totally. That is all right. So that is it for the multiplication concerning the weight. So the weight must always be the person's kg. The weight is in kilograms. So the weight of the person times the 5 mg, the prescription. When you get it correctly, at the end of the day, it ends up 100 mg, just as we have here. Milligrams, mg is for milligrams. So it's also important for us to know these abbreviations too, milligrams, and so on and so forth, as we progress with this medication. So I don't know if we are in order. Can I ride on? Do I continue? Hello, can you hear me?
Yes, right on. Just that these dose per kilo, I understand what you explained. You see that
Okay.
you have a treatment, like for instance, let me say malaria, for instance, and you're supposed to take a total of 200 1,200 milligrams rather. You understand? Is it
Yes,
that
yes.
is it the total amount of drug you're supposed to take for the treatment of that drug? Is it per dose? Let me understand, or maybe I should hold on. Am I being too forward?
Okay. No. Why should you be? You are not. Okay. Now, what this is actually saying is, if a drug is prescribed for a patient that is maybe 20 kg, that's the weight of the patient, okay, and this drug is prescribed at 5 milligrams per kg, that's 5 milligrams for 1 kg. If the person is just 1 kg, maybe if there's a person that is of just 1 kg weight, that means the person would take exactly 5 milligrams of that dose. You understand? But if in this case that the person is 20 kg, when you multiply the two, the milligrams you are supposed to give to the person times the weight of the person, that's where weight comes into it when we are talking about dosage. At the end of the day, the person is going to end up taking 100 milligrams total dose, 100 milligrams for that person. I don't know if that's your question, if I got it right.
Okay,
Or
that's
perhaps Madam Pat understand.
I wanted to
Yes,
confirm if
total.
it's total dose or per dose, for instance. That's what I wanted to
Okay, total dose. When you times it, you get the total dose, just as you've seen it there. If you can see the screen, you'll see that the total dose will now be that 5 milligrams times the person's kg, which will give you 100 mg, which is the total dose. I hope that's good.
Okay.
Okay, so let's move. Today we want to see how best, because if we don't complete it, we have I think about 6 more modules, so we just see how to do justice to it. So let's go. So we also have age-based dosages too that are sometimes adjusted based on age, like we said, based on age, to account for the differences in maybe the person's ability to tolerate the drugs, or for the metabolism, or certain factors, especially pediatric dosage. We have the normal guidelines for pediatric, that's for children, pediatric. Pediatricians know how to give this particular dosage depending on, like we said, the kg, depending on the tolerance, on how adverse, on how harsh, or how the drugs will come through to the child at that particular age. So we already have guidelines that govern that, which all pharmacists are taught in the course of their pharmaceutical classes. You know, they are taught, they are given these guidelines. So if you follow the guidelines, you know how to match the dose with the age of this particular child. But we have ranges. It's just like BP, blood pressure. They will tell you 120 to 180. So anything within that range to 80, rather, the systolic and the diastolic reading. So range means that it may not definitely be exactly that figure, but it has a range. Between this to this is okay for you to give to a child of so age. So that is the age-based dosages. All right, now converting units. I think we already did this one. Converting 1 gram, 1,000 milligrams, 1 kilogram, 1,000 grams, 1 liter, 1,000 milliliters, 1 teaspoon, 1 tablespoon, 15 milliliters. We have already looked at it. So it is important that we need to know how to actually convert these units to ensure accurate dosage. Yes, yesterday, we didn't follow the normal protocol because we were about 30 minutes behind schedule. So today, please, we would take 10 minutes break when it is now is 10:47. So exactly 11:30, we'll take a 10 minutes break before we continue to 1 o'clock when we would stop. I think it's 10 to 11, 11, 12, 12 to 1. So 11:30, we'll take a 10 minutes break to stretch our limbs, and then we'll be back to continue the part B. I wouldn't want to extend from 1 o'clock because I know that we are mothers. We want to go and prepare the preparables for the weekend. So I think we all get that. Is it fine by us to take the 10 minutes break?
Fine by me.
Okay. So what is happening now, Madam Patience? I hope our drama of yesterday, I hope network will not do that thing that I'll be talking and you will not hear me, because right now too, I cannot hear you. I only heard Madam Nenna. Okay. It's important you hear me, because when it's exactly that 11:30, I'll have to pause, and you will not, if you are not with us, you won't understand. You think we are done. Okay, so but however, let's continue. So the tablespoon to the milliliters, So now also let's look at examples of the conversion. Let's look at how to convert the examples of converting them, like we had already done, which we can still continue to do it. We can still move and continue. Now, if a patient needs, like the example that we have here, if a patient needs 250 milligrams of a liquid medication, and the medication is available as 125 milligrams. Sometimes it happens, maybe you don't have the exact mg of that particular drug in the pharmacy. You have a lower quantity. So all you need to do is to add it and put it together so that you would get it right. So if you have the 250 and the medication is available as 125, per 5 meals. So what you need to do is to calculate how many milliliters to give. It's as simple as that. It's as very simple as that. You just do the calculation. Now, let us look at it. As we have here, volume to administer, dose required concentration equals to, you have the 250 milligrams, and that's the prescription that the patient actually needs, 250 milligrams. And you don't have that quantity, you don't have that particular quantity, you have it in 125 milligrams. All you need to do is you give 2 of that 125 milligrams, because 125 plus 2, times 2 will give you 250. Repeated addition, if you add 125 to another 125, you have 250. If you times 125 by 2, you have 250. So the 250 milligrams is what you would give in 125, 125. So at the end of the day, 5 meals, since 5 meals equals to 125, you give the person 10 meals in order to make up for the 250 milligrams for the person to take. So you see the conversion, because most times this prescription may not come in the way you have it in your stock. So you have to make sure that the milligrams aligns, because if you give a person that should take 250 milligrams, you give the person 125 milligrams, there is shortage. You don't expect that it will serve the same purpose as the 250 would. So it's important that we know how to go about it, the conversions and the calculations in this case. So I think that's understood. Madam Nena, can I ride on? Are we together?
Yes, ride on.
Okay, good. So now, calculating dosages on different routes of administration of the drugs, different ways, different means with which they take the drugs. We have the oral, we have the intravenous, we have the intramuscular kind of drugs. And the dosages must sometimes be adjusted depending on how it is taken. Very important. And once again, it's important for us to be able to calculate the dose. Regardless of whichever way the person is taking the drugs, we should be able to give proper, calculate the exact dose that will bring proper delivery. Okay. Common different routes of administration includes, we have the oral, we have the intravenous, we have the intramuscular, we have the subcutaneous, we have the topical. It is self-explanatory. The topical is skin, the medications. The subcutaneous is injected under the skin. We have the intramuscular injected into a muscle. They have to look for a muscle to inject it. We have the intravenous, like we already know, into the vein. They'll just say tie your hand and let your vein come out, and then they inject it, or oral through the mouth. So the dosage may need to be adjusted based on the way this medicine is to be taken or is to be absorbed into the body. Okay, for instance, again, we get to another calculation. Now, for instance, a patient weighs 75 kg and is given a medication at a dosage of 10 milligrams per kg.
Sorry,
That's
ma.
10
Sorry
milligrams
for
per
taking us
kg.
back.
That's
Hello, ma. Hello, ma. Sorry
okay.
for taking us
Yes,
back.
please.
That's
Yes.
tropical. Can you
No problem.
show me again? Sorry. The
Okay.
tropical.
Topical. No, it's
Okay,
topical.
topical.
TOPICL.
Okay.
Yes,
Okay.
topical is applied to the skin.
Okay.
Yes, some drugs are applied on the skin depending on the illness or depending on the challenge that the person has. So topical drugs are those ones that are applied on the skin.
Okay. I'm okay.
Okay, so all right. So now we're looking at calculation, another one. A patient weighs 75 kg and is given a medication or prescribed a medication at a dosage of 10 milligrams per kg. That's to say that if the person is 1 kg, the person needs to take 10 milligrams. Okay, but if the person is more than that kg, we have to do some work. We have to calculate. So calculate the daily dose of it. Now, 75 kg times 10 mg, because we are told that 1 kg will give you 10 mg. That's a person that is just 1 kg should take 10 mg. So now that the person is 75 kg, you have to times it by 10 to have the total the total mg milligrams of drugs that the person is supposed to take. So when you times it, you get 750 milligrams. Now, if the medication is to be taken 3 times a day, if it's supposed to be taken 3 times a day, remember that 750 is the total dose. 750 is the total dose of the drug that the person is supposed to take. And then they have said now that this 750, that the person has to take it 3 times in a day. That is morning, afternoon, and then evening. So simply what you do is to do the division. You have to now come and take the 750 and
That's
divide it by 3 so that
250
you
per
know
day.
the quantity that the person would take. Yes, you divide it by 3 to know the quantity that the person would take in the morning, in the afternoon, and in the evening. So you come out with 250 mg. So that means when you are giving the person the drugs, you now have to explain that, okay, this you take in the morning, 250 mg. This one you take in the afternoon, 250 mg. This one you take in the evening, 250 mg. And totally, when you put it together, you come out with the 750 mg. So you see how division and subtraction and addition can come into play for us as for pharmacy technicians while they are doing their work. So I think that's explanatory enough. So let's move to the next one. Please, if there's any question, don't hesitate to stop me, Madam Nena. All right, so now, that having said, we have actually done justice to that. We are going to module 4, and we'll take that in few, okay, we still have time, so we'll see how we can run this particular module. Now, pharmacy dispensing practice. Pharmacy dispensing practice. It is important that we know how we go about dispensing medications, because that is one major duty of a pharmacy technician, dispensing medications. Okay, so now, how can we dispense medications? We need to interpret the prescription. When a prescription comes in, hello?
Hello? Hello?
Hello, Madam Pat. We've been waiting for you. What
Hello?
happened? Can you hear
Hello?
us? Can you hear
Yes,
me?
I can hear you.
Sorry, we've been waiting for you all the while. I don't know what happened. What happened?
I'm hearing you, please. People that are not hearing me.
Are you-
Network.
Network. Sorry. Okay, sorry. Hello, Doc. Are you there?
Yes, I am.
No, Doc. I'm asking of Doc. I just stopped speaking. I don't know what. Hello,
Sorry.
Dr. Dorothy.
Can
Are
we hear?
you there?
Yes, can you
Okay,
hear
I can
me?
hear you. Yes, I can hear
Yes.
you.
Okay.
Pat
All right,
is
sorry
here.
for that. Madam Pat, thank God. I think that thing happened. The same thing that happened yesterday, because I couldn't hear you. I was telling Madam Nena that we were going to have a break by 11:30, and I
Yes, I heard you
asked her if it
mention it.
was fine by her. She said yes. Okay, so but I couldn't hear you on the other side. Okay, thank God you are back. So we're talking about prescription, that it's important that we understand and we are able to interpret any prescription, because of course, if you cannot interpret the prescription, the fact is, why are you actually there? That is just the thing. So we need to know how to interpret this prescriptions. Very important. Proper understanding of the prescription helps you to be able to serve these patients better, for you to know the correct medications, and for you to equally know the right dosage with clear instructions, because not only knowing, you have to give clear instructions as to how the patients would take the medications that you have given to them. So we are going to look at it. Aspects involved in interpreting a prescription is the next slide that we are going to look at. So let's go to the next slide. Now, understanding prescription components, there are many things that you need to know about understanding prescription. You see, I just had to laugh. It's funny. I had to laugh because talking about prescriptions, you know, my daughter and my mother went to went to gather drugs and they brought it for me. They went to bring antibiotics and BP drugs and brought it for me because I'm talking about prescription. It's very funny. All right. So there are things that we have to, key components that we have to note when we are talking about prescription. The patient's information is very important. Let's not just do it blindly. Let's get it right, the proper way that it's supposed to be. Let's get it right. The patient's information has to be there. What's the patient's name? What's the address? What's the date of birth? These are things that are very vital information. And as a pharmacy technician, you have to remember this is one of you do administrative work as well. So you have to ensure that all these things are filled. The reason is that there are many instances that maybe, God forbid it, maybe you actually give medication based on a prescription and something happens at the end of the day. So
Hello,
Hello?
is anybody there?
Yes.
Hope is well. We are not hearing Madam Dorothy's voice again.
I don't even know again.
It is well with this network. Oh.
Nena. Madam Nena.
Maybe it is not online. Oh, network.
Madam Nena. Madam Nena.
Maybe network. Maybe network.
What is happening? Oh,
I don't even know. Or is it the break? Because I know
I
it's
don't
the
think
break, Madam Dorothy.
Madam Dorothy is off now.
Please, it's network issues, she will join back. She is coming. It's network, It's network, please.
Madam Nena. Madam Nena.
I was just locked out. I was just locked out. Sorry for that. Just all of it, just like that, just went off and I had to start again. Sorry
You
for that
understand?
break. Are we together? Sorry, I had
Ye-
to change. Okay. So, Madam Nena, did you just disappear from the platform? Thank you for your patience for waiting. I don't know what happened. Okay. Let's see if I can reach her to come back. Perhaps she just left thinking that it's network. Network just locked me out. Please give me a minute. Let me get
Madam Nena.
because she's obviously not on the platform.
But I'm
That's
seeing one matter there now.
yes, Martha. Martha is a different person. Is a lady that couldn't log in yesterday.
Okay,
Hello,
okay, okay.
Martha. Martha, you're welcome. It's nice to have you. Though you are late, what happened today? I was really praying that network does not hold you.
So the network, but I thank God I'm here now.
Okay, I've tried to get Nina. She's on a call, perhaps. All right, so let's continue. She'll join us. Martha, it's nice to have you. We have moved far. We have two other persons with us, Madam Patience, that started with us yesterday, and Madam Nena, that has, I presume, just stepped out, that would be back. So we are three for this particular course, and we're actually looking forward to have you so that we would so that will be complete. So you are welcome. For the benefit of you that just joined us, you can be rest assured that you'd have the slides to be able to catch up with the other side. And we have a registered participants group. So if you have any questions, maybe going through the slides at the end of today, I'll send the slides for today that we have done yesterday, and today I'll drop it on the registered participants group so you can follow up from there. You can just pick it up from there and then go through. If you have any questions or any challenges, you can drop it there, or you already have my number, you can DM me, and then we can do another training there with you paying me an extra fee, a double
Yes.
fee for that. So, all right, so let's quickly continue. Before you came, we were looking at least let me take it back to the module. We were looking at pharmacy dispensing practice. We have finished talking about the first module that we had, pharmacy calculations, how to calculate doses of drugs, how to ensure that we have the correct doses. Maybe if a person is supposed to be taking a particular tablet twice in a day, how to calculate it. You have to know how to add, how to subtract, how to do all those things. We have looked at it. Now we want to look at the pharmacy dispensing practice. Like we said, that it is very, very important for pharmacists or pharmacy technician to know how to dispense drugs. And there are certain rules, there are certain key components, things you have to take into consideration when you want to dispense drugs. That is what we wanted to start looking at before that break in transmission. Okay. Okay, then we have a patient. We're looking at those things. What are these key components? We have the patient's information. That's to say, when you get a prescription, you must ensure that you know the patient that you are dealing with. You have the patient's address. You have the date of birth. These are information that you must have. The patient must supply this information. And obviously, and of course, it should be on the prescription so that, excuse me, so that for follow-up, for continuity, in case of anything, you would know exactly what to do or what has to be done. So the patient's information, the prescriber's information of the doctor, from which hospital, where is this prescription coming from? These are things that you need to know. The license number, the contact information that you can reach out to. Remember, I said that pharmacy technicians that you actually collaborate with other healthcare professionals. So you need to have the contact in case there's something that does not fall in place. In case that there are some things that don't actually align or fall in place in the course of you trying to dispense drugs. So you can reach out, the pharmacists can reach out to those people, can reach out to the appropriate quarters to know how to go about it. Hence, you need all this information. Then the drug name too, the name of the medication to be dispensed. Yesterday, we talked about generic names, we talked about chemical names, and we talked about brand names. So before you dispense a drug, at least you should have the generic name should be there, or the brand name. It doesn't have to necessarily have the chemical name, but the generic name or the brand name is very important so that you know exactly.
I'm here. Oh, sorry, ma'am.
Yeah,
You're welcome. You're welcome, Nena.
Nena.
Sorry, I had a very emergency. I'm okay.
I thought as much because I called you. You know what happened was that as I was just talking, all of a sudden I was logged out. It's the first time I'm just like that. It just went off. I said, what could be the problem?
The system is in the spirit. It knows I shouldn't miss anything.
Yeah. Okay. I thought it happened before you even left. So I had to see how to adjust it, and then we came back.
No,
So
I've already left. I'm sure I've left before it happened. Yeah.
Okay. All right. So yes, we're talking about the key information, the dosage, the administration, the strength or potency of the medication, which most likely should be the duty of the pharmacist to actually look into the potency or the concentration of the medication. Remember, like for you, Martha, that has just joined us, you work directly with the pharmacist. You don't have your own, you don't take unilateral decisions. Even when you see something is not normal, you reach out to the pharmacist to complain, and then work hand in hand with the pharmacist. Because whatever happens, first and foremost, the person that will be held responsible is the pharmacist, and you too will be held responsible by extension. But anything that goes out of the pharmacy should be authorized by the pharmacist. He should be in the know. That's the summary of it. So when you do these things, ensure that it aligns with the pharmacies, with the pharmacy also going through it before it's actually administered or given to a patient. Okay, so the route or the routes, whichever one, whether British or American, it's route or route. So of administration, the method by which the medication is to be administered. We've talked about that severally: intravenous, through the veins, oral, you swallow, and intramuscular, through the muscle. They just want to give you, there's some injections they give, they put it through the muscles. It's for a particular reason. Now, we have the frequency, how often the medication is supposed to be taken, the total amount of the medication, how many, like we did a lot of calculations earlier today when we started. So the quantity, the amount, so that it does not exceed the dose. You must give the exact amount. Let patients not have a challenge of saying it was not enough, because it happens in most of these maybe chemists and patent drugstores, where you just have people that are not well trained. You just want to sell your drugs, and you just hire someone. The person has no knowledge, does not have the right training. The person is just there. You want Panadol, picks and gives. You want these picks and gives. And most times they dispense drugs that are not complete. At the end of the day, you see there are shortages. If someone is taking a drug for 7 days and is supposed to take twice in a day, you are supposed to give the person 14 drugs. At the end, maybe because of the fact that you are not doing your job judiciously, or you don't actually know the right things to do, just put together the drug, and the patient is like taking a shortage. It's ending up with 12. And for somebody like me, before I decided to give my life to Christ, let me say so. And now I've given my life to Christ. I like to swallow medicine. So that time that I did not like to take drugs, if you give me 12, you are even doing me a favor, because I'll take the 12 and I'll be very happy. And at some point when you are not feeling well and you take medication, now that medication starts to work. That is the misconception I used to have that time. See, knowledge is very important. I used to have. So when I take drugs, they can give medications to my mother. At that time, she'll ensure that you take your drugs, But when I now left and started staying by myself during my university days, early university days, I would take those drugs and I would not complete the dose. Why? Because when I start taking them, I'll take maybe the first dose, the second dose, maybe if it's a 7-day drug, I'll take the first day, the second day, the third day religiously, and I start feeling better. Obviously, that's what happens. I'll start feeling better. Oh, that drug is working. It's actually doing well. It's actually doing this. I start feeling better. At the end of the day, as soon as I feel better, I don't feel those symptoms again that I was feeling. I have just abandoned the drug. So if you come to my room that time, you see medications. Some I don't even know when they gave me out because I will never complete medications, but it was not good. It did not help me. As time progressed and with the right knowledge, I knew that I was actually getting it wrongly as at that time. So frequency, how a medication is supposed to be taken, the quantity is very important. The number of times the prescription can be refilled. It can be especially refillable drugs that has to be taken, maybe finishes and you get to take another one. That is refillable drugs. It's finished, you have to go and refill it again to meet up the particular dosage or to complete what you're actually supposed to take. Now, it is important that you know the number of times that particular prescription can be refilled, can be given again in the container continuously. You need to know specific instructions for the patient as to when, like this one is equally very important, as to when you should be taking drugs, as to when you should take that drugs. There are some drugs, medications that you need to take before you sleep. There are some medications that you need to you should take it with food. Most medications, anyway, are to be taken with food. There are some that will say, don't take fatty foods. Don't take food before taking that medication. Don't take foods that are fatty, that contains a lot of fat, because it will interact with that medication. It will disrupt the efficacy of that medication. So certain instructions are important for certain drugs. So you have to make sure that you explain and you take note of them when the prescription actually comes, so that you'll be able to explain to the patient, okay, this one you are supposed to take it before you sleep. You're supposed to take it before you sleep. Like some drugs that are actually given, antibiotics, they will tell you, take it at so time, take it after 8 hours. Those are instructions that you need to know so that you'll be able to pass across to your patients. You need to tell them, explain to them, for them to have informed decisions and on as to how to go about taking the medications. So these are some of the things that we have. So now we want to look at these abbreviations. They are important because you get to see them. They are abbreviations that can be used in the course of you dispensing drugs. The pharmacist can tell you, or you need to sometimes even do the explanation to the patients. Very, very important. So now let us look at, like I was trying to say, let's look at some of those abbreviations. We have the AC, before meals. So when you see AC, you know that means before meals. This drug has to be taken AC. That should be taken before meals. Then you can equally see some of those drugs that will say PC, after meals, BID, twice a day, 3 times a day, TID, QID, 4 times a day, and all this. There are things that, thank God, you are going to have it. There are abbreviations that are very, very important when you are actually giving these drugs. Then we have the PRN, taken. There are drugs to take. They'll tell you, take it as needed. That is, maybe there are drugs you take when you actually feel some particular symptoms. So you take it as at when it is needed. They don't tell you take it in the morning, take it in the evening, take it when you have those symptoms. Most times, like people that maybe you don't follow a strict doctor's prescription, like you actually go to the hospital, to take it, to be given the prescription, and you just have headache. Of course, you need to get paracetamol because you need to take it as you are having that symptom of headache at the moment. So there are some drugs that are PRN that you take as needed. There are those that you take PO by mouth. There's IM intramuscular. IM are drugs, injections, most especially that are given through the muscle, like I talked about. They are given for certain illnesses, certain diseases or illnesses given through the muscles. Okay, we also have, this is a continuation of, okay, we also have the intravenous, the IV, we have the QD, the QD, that's QHS. What do we mean by the QHS? It refers to drugs that are prescriptions or instructions that indicate a medication that should be taken once daily and at bedtime, only at bedtime, QHS. There are drugs that you only need to take them when you want to sleep at bedtime and not before bedtime. Very important. Okay, so we also have the every night, we also have every 4 hours, Q4H. That's you take it after every 4 hours. You take it after every 4 hours. So these are abbreviations that are needed, that is important for us to get so that we'll be able to handle when we see them or when the doctor makes reference to it. Like this QHS that I want to talk about, it talks about, like I said, medications that you should take once a day, specifically at bedtime when you need to sleep. Then every hour, 4 hours, every night, and so on and so forth. So understanding these abbreviations can help you as a pharmacy technician to accurately prepare and communicate the prescription details to the patients. Do not give drug at any point, whether the person asks you or not, because, you know, people are different. There are people that may not really, maybe they don't know, but you that has the right knowledge, you have to tell them. There are the people that will ask you, oh, please, how do I take the drugs? In case they have a pharmacy technician or they have a pharmacist or they have someone that really doesn't know his or her job. They can even teach you the job by saying, okay, you've given me this, please, how many times am I supposed to take it? And you know, doctors' handwriting, even if they are to look at the prescription, it's common knowledge that doctors don't write. I've not seen any doctors, I mean medical doctors, not academic doctors this time. Medical doctors, most of them don't have good handwriting. And it is real. Most of them write in such a way that you need to, I don't know what you would need to be able to understand what they have written. So most times, even if the prescription is already given to the patient, like some of us in those days, when they give the prescription, they'll pass it in a file, tell us, hand it over to the pharmacy, which most times is not the right practice. Hand it over to the pharmacist. On the way, we'll open it and look at it. Somebody like me, I'm very inquisitive. I open it and look at it in those days to see what did they write, what they say I should take. I hope there's no injection, because anything injection drugs, I hope there's no injection. So if I see injection already, the fear of the injection has already started even before the file or the folder actually lands in the hand of the pharmacist or the pharmacy technician. So sometimes you don't get to read the handwriting. So that is practically what we are looking at. Then there are some red flags in prescriptions. Before I continue, because network may not be friendly, I just pray that it helps us. I need to find out, are we together? We have 7 minutes to go before we leave for break. Just 7 minutes more. Are we together?
Yes,
Can you hear me? Okay.
yes,
Okay.
we're here.
Okay. So red flags in prescriptions, there are red flags, like you can see that flag there. Some common red flags can include the handwriting, like I just finished talking about. If you have prescriptions that are difficult to read, thank God there are numbers. Please don't hesitate to reach out through the number that has sent it, to reach out so that you can actually understand what you are expected to do. Okay, so you easily get to understand what you are expected to do. So these red flags are incorrect, illegible handwriting, somebody writes in a way that you cannot see. Because if you cannot see, of course, obviously it will lead to errors in you interpreting the prescription. Incorrect dosage too Ensure that the dosage is appropriate for the patient and intended treatment. You know, I said that you work as a team. The pharmacist, the pharmacy technician, the doctors, the nurses, you work together as a team. So if you see, with your knowledge and your expertise, you see that the dosage does not commensurate with the age of the person or the age, the patient's kg, or all the things that needs to be taken into consideration, please ensure that you reach out, you speak to the pharmacist and follow due process. Get to the bottom of it. Now, we also have missing information. Make sure that all information is included on the prescription that is needed. We've talked about information that should be included. Abbreviations too. Most times, confusing abbreviations, it can be misinterpreted. So it is important that while it is written, all those AD, QHS, QD, all those things, you should know what they mean. And if you don't know what they mean, reach out to the pharmacist. It's better to find out, to learn, to ask for, to understand what you don't know than blindly doing what you don't know, because the results can be devastating. So that's important. Then drug interactions. Identify any potential interactions between the prescribed medication and other medications the patients may be taking, because sometimes you can be given a medication and discover you, and maybe in the course of giving you, it is discovered that you are taking another medication that will have adverse effects, or that will interact to reduce the potency of this other medication that they want to give you. So these are things that we really need to know before. So when you have a thorough understanding of the prescription, the abbreviations, but potential issues, you can identify any issue that will be lurking somewhere. You can identify any issue, and it will help us to prevent these errors that we fight against every day in the pharmaceutical business, and promote, and it will help us overall, holistically, to come up with patient safety and good health outcomes for patients. So we have another one. Preparing and packaging medications is important. Medication packaging. This one is another on its own. Under pharmacology, it's another branch on its own that they take a whole period, a whole course. You need to take a course on medication packaging, because, you know, the way you package something is very important, because it can go a long way. Like I keep saying this thing, it can create adverse effects if not done properly, if you don't follow the standard precautionary measures, if you don't follow everything that needs to be followed. Infection is everywhere. Infection is everywhere. So you have to ensure that you follow the due process in order not to contaminate the drug before even it gets to the hand of the patient. That's why health workers are advised to always carry out hand hygiene, to always ensure that their PPE, they are clean all the time. You don't carry long hair as a pharmacy technician or a pharmacist, or even in the medical profession. You don't carry out that kind of hair. Sorry, you don't carry that kind of hair, long hair like that. You don't carry a very long hair, you know. It's not advisable to do so. So at this point, because this is 11:28, if we delve into this, is a particular aspect that I'll have to take time to really explain it. So I think at this point, let's take our break for now, and we would be back exactly 11:40. We'll be back exactly 11:40. Please, let's take our break. Please, are we together? Can everybody hear me?
Yes. Okay, ma.
Okay, so let's stretch our legs now. We can answer all the calls we need to answer. Thank you.
Okay, thank you.